Assalamu alaikum. Good evening and welcome to Humanity First UK's webinar on tackling vaccine hesitancy. And we're extremely lucky today to be joined by Dr. Faheem Younus. Dr. Faheem Younus is Chief of Infectious Diseases at the University of Maryland, Upper Chesapeake Health. And Dr. Younus was chosen 3 times by his peers to receive the Top Doc Award given annually by the Baltimore Magazine, and he's also received the Presidential Service Award from the Obama administration in 2008 for his humanitarian services. And Dr. Faheem has been particularly active during the COVID pandemic, providing practical and evidence-based advice. Dr. Faheem Younus, thank you very much for joining us today.
Thank you, Hamad, for having me.
Dr. Faheem, I think we can get straight on into it, but if we just sort of pause for a second, take a step back, and just think about how far we've come through this pandemic so far. In the very early days, about a year ago, no one was really sure how things would pan out. Everyone thought when the vaccine comes, things will change. How would you sort of, looking back over the last year, look to see what progress has been in the last year, and how would you judge that?
Yeah, it's surreal. I think we will truly realize the impact many years down the road. If last year at this time you told me that we will have millions of COVID cases within a year, I would have believed it in a heartbeat. But if you had told me that you'll be vaccinated as well against this virus within a year, I would have fallen out of my chair. I think that would have been out of realm, even for someone like myself who's done infectious diseases for 20 years. The kind of collaboration we've seen, the development of treatments, the understanding of this virus. So there's amazing progress that has been made, but at the cost of significant devastation.
And one of the first questions that comes to mind around this question of vaccines is that there's a lot of people out there who are thinking, the COVID has been very difficult, but the people who really have been affected are the elderly people or people with an underlying condition, all of those people who fit into what we might call the high risk categories. And we've been talking about this for the last year. So if someone were, and I'm not saying I am young, fit and healthy, but if someone were young, fit and healthy, they might think, why should I get vaccinated? It's not going to, COVID isn't going to harm me. Once it's gone, it's gone. If I get it, it doesn't matter. I won't get badly affected. Why should I bother getting vaccinated?
Yeah, it's a great question. I think logically they have a point. If we had low amount of vaccine, if there was a constant supply and demand issue, I think, yes, the vaccine should go to elderly first, as we have been doing in many Western countries, as well as the rest of the world. But the reality is COVID is not a disease of elderly. It impacts everyone. And thousands of young people have actually died due to COVID. We've had to put young people on ventilators in our own hospital. It's less common, but it's not zero. And the second notion that COVID, everyone gets better after a week or two with just some cough, cold, and sniffle is also not accurate. About 20 to 30% of COVID recovered patients have been reporting some long-term effect, whether that's fatigue, constant shortness of breath, anxiety, palpitations. We don't understand that phenomenon fully. And the third point, which is also documented, Hamad, is yes, I may not get deathly ill if I'm a young, skinny, healthy, athletic person, but my carrier state, the virus in me, I could pass it on to my elderly family members. And there was a super spreader event in Maine, USA last year, where 55 people attended a wedding. Over 150 ended up getting the infection, and 8 people died who never attended the wedding, but they were relative of these people who went to the wedding. So those are the 3 reasons I would say. You still have a risk of death, you have a risk of hospitalization or prolonged symptoms, and number 3, you could harm your own family. And the risk of vaccine is near zero. It's less than 1% long term. So when you compare those 2 risks, really, what is the risk of vaccine? And we'll talk about it a little bit more. It becomes a no-brainer.
And so thinking about that, particular aspect of this, people will be understandably a little bit hesitant, perhaps wondering, what are the potential side effects of the. And we talk about the vaccine, but there are a number of different vaccines available. So, what are those side effects, and what should people be worried about?
Yep. So I think this is where we have to be very honest and transparent. Most of these vaccines, you're likely to have short term. So the key word here is short lived, 1 to 2 days, arm pain,
Mm,
fever, fatigue, dizziness. I've had some of my team members, and by the way, we've vaccinated over 3,000 team members just in my own hospital system. So these are
mm,
3,000 people that I have data on myself. And then today, CDC published a report with the first 13 million plus Americans who received either the Pfizer or Moderna in the first month. So now we have a lot of data. This is not a small data set.
mm,
A lot, 5 to 10% of the people will experience these symptoms. You'll get better within a day or two. As far as long-term side effects, that's usually a 1 in a million sort of effect. That's not a common thing. When you start comparing that risk with car accidents and other things that we do every day, you contextualize it and you say, well, this is the kind of risk we take almost every time, every day. There is a risk of allergic reactions, which is CDC projects after a study of those 13 million Americans at 4.5 in 1 million cases. All of those
mm,
anaphylactic reactions are treatable, no one died. And that is why we monitor these patients for at least half an hour. So short-term side effects, very common with all vaccines, and that is actually a good thing. That's because your body is working. Your body has been
yeah,
fooled, tricked into believing that the virus is in, and you have a lot of antibody being printed in your body. I use that example as if you sent an email to a printer and now the printer is just churning those papers out. That's what's happening in our immune system. But as far as long-term severe side effects are concerned, typically the risk is about 1 in a million. And that's the kind of risk we take in almost everything in our life every day.
and I guess I can hear that reassurance that the side effects are small, but there's a lot of information, I should say misinformation out there about the COVID vaccines. Some say that it changes your genetic makeup, and other people say, well, it causes infertility because it attacks the uterus, causes infertility in women. I mean, is there any truth to these? I mean, are they just what is that based on, and how true are those things?
Yeah, those are respectfully preposterous claims that
Hmm,
have really they have no foundation. And I say that because I think if I claim that tomorrow's sky is going to fall, the burden of proof is on me. You cannot just be expected to go and find data to convince and rebut my claim. My claim is so out of the league that I should be the one bringing some data why I believe the sky is going to fall. So people can come
hmm,
up with all these theories. There is really no evidence that this vaccine causes infertility. There is no evidence that this vaccine causes any DNA changes. It's actually a mRNA molecule, which is so delicate that it will destroy itself if we kept it on room temperature, right? That is why we need cold chain for Pfizer, Moderna, for all these vaccines. That's why you need a refrigerator, even for Astra Zeneca. The body's temperature is 37 degrees. That's very warm. So this is like a Snapchat message going to our immune system that auto destructs after a few
hmm,
hours, perhaps a day or two. And the important scientific fact is this vaccine never enters the nucleus of the cell where the DNA lives. It goes into the cytoplasm, does its work, and then it auto destructs. So there's no reason for it to cause DNA changes. And there is no virus, not even a viral component in these, at least the vector based and the mRNA vaccines. So it's a scientific impossibility for these vaccines to give COVID. So no one can say that I got COVID from the vaccine. So no risk of infertility. There is absolute, and if somebody has data on that, I'd love to review it. But I think respectfully, the burden is on them. They can't just post something on Facebook and expect the whole medical community to now divert their resources and start chasing and trying to rebut that information. I think people should demand data from those folks who are making such claims, and that's absolutely fear mongering and disinformation.
Now, thank you for that, Dr. Faheem. A couple of things that come to mind immediately is we know that unfortunately vaccine uptake within Black communities and within South Asian communities is less. And has there been enough testing done? Is there any reason for anxiety for those groups about the COVID vaccines? Is there any particular risk for them that if COVID affects them worse, and we know that it does, that the vaccine will also affect them worse? Is there anything that they need to be worried about?
Yeah, that's a great question. Actually, it's a whole area of healthcare disparities. And if I forget a part of your question, please remind me. Let's start where the facts are very clear. The risk of COVID is higher in African American, Mexican, Asian communities, and there are multiple reasons for that. Number one reason is that the comorbidities are more common, they're higher in these communities. For whatever reason, that's a different conversation. But obesity, diabetes, hypertension, heart disease, all of these, the prevalence of these diseases in these socioeconomic and ethnic minorities is higher. So therefore, they are at a higher risk of bad outcomes, death, or even hospitalization. Right here in US, in Washington, DC, which is an hour away from me, I think it's about 70% of all COVID deaths have occurred in African American community. The second thing is also tragic, but true, is socioeconomic status. A lot of people, or a larger population, I should say, in these ethnic minorities don't have the liberty to just work from home. If you're working in a meat plant, if you're a bus driver, if you are on the frontline essential provider, you really are at a higher risk. And then third is really what kind of education and what leadership messages they are receiving in their church, in their house of worship, from their political leaders that they identify with. So all of those things ultimately put people at a higher risk. Now, there is no evidence that these vaccines will have worse outcomes or more side effects among these ethnic minorities. As I said, 13 million is a very big number, Hamad. And all in all, let me just double check. I wanted to give you the exact number. 72.8 million vaccines have been administered just in USA. That's a large number. So if there was a risk of increased infections in these minorities, we would have found out by now. That's not the case. And now the third question is really, what is the reason of distrust? And that's again very complex. But one thing I can tell you for the African American community, and I've talked to a lot of them, a lot of my team members in my hospital systems are African American. And we cannot forget the very tragic past, the Tuskegee trials, the human right violations that have been done in the name of research with African American community, at least in the West, particularly in the USA. So there are some very real facts and realities that we gotta face. There are people whose ancestors were part of those clinical trials which were inhumane. And I think that leaves a scar on your trust. And it takes time to rebuild that trust. But one thing, I'll just close with that. The thing that I found most powerful, inspirational, generating trust was Dr. Izzy, the PhD physician at NIH, who is one of the founders of the Moderna vaccine. So that is a game changer. When I go and tell them, all you have to do is put her picture up, and then an African American heart connects with that and actually sees some vindication that, what our forefathers went through. Today, this is one of our own daughters who's the inventor of this vaccine. So I think that's how trust can be rebuilt.
And it feels like that's a really important thing. And whether it's the Moderna vaccine, Pfizer BioNTech, Oxford Astra Zeneca, we see international collaborations of scientists and doctors around the world really coming together at this time of crisis for the whole world. One question which has been put again and again is the question of pregnant women and women who are breastfeeding. Has there been any research done pertaining to them and the COVID vaccination? Is it safe for them? Should they use it?
Great question. So the short answer is yes, they should use it. The more nuanced answer is these vaccines initially, when they were tested in those phase 3 trials, of course, pregnant ladies were not enrolled in those trials. But as life happens along the way, these were trials that had over 7,000 volunteers in both of these, at least Pfizer and Moderna. And at the end of the trial, they realized that a couple of dozen ladies actually did get pregnant during the trial. So that gave sample size for researchers to study what happens. Again, small sample size, but we have not seen any adverse events associated with the vaccine. Particularly, the risk of miscarriage was not increased between placebo versus the vaccine arm. Once again, this vaccine, there is no virus, nothing gets transmitted through breastfeeding. So the work, and I think you work in hospitals, we have about 80% of our team members are female because of a lot of nursing staff and our staff being female, and a large number of them are in their reproductive years. So this is a very common question I get during our hospital conversations. And today we feel quite comfortable, and CDC has also recommended that ladies who are pregnant or are breastfeeding can take the vaccine. Now, here's the caveat. It also depends on your exposure and your timing where you are in your gestation. If you're in the 8th month of gestation and you're staying home and you have zero exposure, I see nothing wrong with you deferring that vaccine just for your own peace of mind until delivery. If you are in your 3rd or 4th month of your pregnancy and you're working on the front lines in a hospital, it's a totally different ball game and you should get the vaccine. So you always have to measure risk versus exposure versus benefit.
Thank you very much, Dr. Faheem. A few questions coming up on the chat, and I think I'd like to address them to do really with the development of the COVID vaccines. And we said this was an enormous international effort, collaboration between many, many scientists, huge amount of funding. But people are feeling anxious that, was it rushed? Normally it takes 10 years to develop a vaccine. How is it that we were able to do it in a year? And did they skip something? Did they skip the animal trials? Have they skipped some really important part of vaccine testing, which otherwise should have happened?
This is a brilliant question. And actually, I had the exact same question in July of last year when I kept on reading, and I'm like, how is this going to be possible? Because that was a new thing for myself as well. And this goes to the point as to how good information, good education, open mind can help us change our positions for the better. That is true. A typical vaccine development takes 8 to 10 years. Actually, 3 of the biggest threats to the world, malaria, tuberculosis, and HIV, after decades and even centuries, still don't have a vaccine. So all of those are realities. But how did we were able to get a COVID vaccine within a year is by cutting through a lot of bureaucracy and not cutting any corners. And I'll explain why. There are 4 key steps in vaccine development. You have to first find the target against which you're going to build a vaccine. Number 2 are phase 1, 2, and 3 trials. That can take about 5 years. The target identification can take about 2 years, so 7 years right there. Then 1 or 2 years in manufacturing and just building the capacity, and the last year in regulatory approvals like FDA and other country approvals. So that's how you get to a 10-year process. For SARS, actually the identification of the target, the spike protein, was done 10 years ago for the first SARS virus that caused a mini pandemic, I would say, in 2008. So there was a lot of research. That was also a coronavirus, and the spike protein target was identified for many years. And that is why we were able to cut out 2 years right there, and the scientists got going with that pre-identified target from say, a younger brother of this virus. Now, second part about phase 1, 2, and 3 trials, correct, that takes about 5 years because you have to accumulate thousands of patients. Now, unfortunately, it's an unfortunate reality. It's a bittersweet thing that we had so much disease around the world. We were having hundreds of thousands of cases a day. So it was not difficult to quickly enroll 40 or 50,000 volunteers, divide them in two arms, and quickly analyze the number of incidents or infection that they're having. It was just the sheer number of virus in the community that allowed that process to be sped up from 5 years and compress it into 3 months. The third step of 2 years of manufacturing, because for pharmaceutical industries realize this is an investment decision. They want to take their time to build factories and make sure that this investment will pay off. And that is where most governments jumped in. And as we know, they subsidized this vaccine, and the US government said we're going to throw in $500 million or $1 billion in certain cases. Just go ahead and build this vaccine. If it doesn't pay off, your risk is covered. And the last step of FDA approvals, just because of the pressure of this pandemic, those approvals were sped up down to weeks from a year that it typically takes. And all of us who work uh, in different leadership positions, you understand that when there's a pressure of something, people come together and those timelines can be compressed. So that is how, without compromising science, a pre-identified vaccine target, number one, two, lots of disease in the community so people could be enrolled within months. Number two, three, government subsidies to cover the financial risk. And four, a quick approval process from Pfizer and from FDA. And by the way, it was very transparent. I even had questions about that. Well, they're approving it too quickly. Are there any conflicts of interests? But what was heartwarming, that whole 72-page document was made available 48 hours before FDA approved it on the web for anyone to review. And I printed and reviewed all those documents myself, and that's what gave me comfort. So I think this is how these timelines were compressed. And I believe the science and the industries changed forever. I do not think vaccines will take 10, 15 years for development in the future.
I mean, in some ways, it's quite heartwarming to know that with the political will, it is possible really to affect significant change and bring these sorts of vaccines to fruition very, very quickly. And hopefully, as you say, we'll be able to hold politicians to that in the future as well and prioritize those things. And just to make it very, very clear, if I can recap, there are various phases. You said there are various phases of vaccine testing. We've been through all of those. We've gone as far as phase 3 of the trial, the safety of the trial. And because there were so many people catching COVID, we were able to complete that in an adequate amount of time to be able to get the vaccine out there. But also the watchfulness for any potential side effects continues. It doesn't stop. So in some ways, the trials for the vaccines continue in respect of the fact that we are continuing to watch. And you mentioned the many people in your own institution who'd been vaccinated, and the fact that many millions of people in the United States, and of course now 20 million people here in the UK have been vaccinated. So those are quite significant numbers, and we've not seen significant side effects as a result of that.
Yeah, Hamad, you make a great point. That's a great point to be underlined, that yes, the scrutiny has not ended. We have not, these are all EUAs, as we call emergency use authorizations. These are not even approvals. So I think the amount of scrutiny over this vaccine is unprecedented. You make an excellent point.
Thank you so much. And I mean, there are still questions out there about. I don't necessarily want to get into huge amounts of detail on this, but the vaccine manufacturers have sought indemnity against civil suits and things like that. I mean, these are presumably normal practices in the industry, or should we be concerned about the fact that they've done this?
Absolutely. If you look at, and again, I have zero conflict of interest, by the way, never got paid a penny from any pharmaceutical company, and don't have any plans either. I want to say that up front. I think but this is important for us to remain cautiously optimistic, cautiously skeptic, but not going to either extremes. There's no reason for us to become so optimistic that we can lose sight of science, and there's no reason for us to go to the other end of conspiracy theories. If you look at penicillin, a drug that has been around for over 70 years, it still continues to cause significant anaphylactic reactions all over the world
Mm,
every year. But there's no drug company that gives you protection, or there is no, you cannot just go and sue a drug company. These are informed decisions. Nobody's mandating this vaccine on anyone. And this is how flu shot is. This is how all those childhood vaccines are that we give to our own children. And just put yourself in the shoes of pharmaceutical company. If you are trying to make a product in the midst of a pandemic for global consumption, can you really, will you be able to give that sort of a guarantee? So I think this is not about guarantees, it's about information, and it's about coming together with science. So I don't want people to have unrealistic expectations. To me, that is an unrealistic expectation.
mm, mm. Thank you, Dr. Faheem. The next question that comes to mind, and it's one that actually people have asked me as well. There are choices as far as the vaccine is concerned. Perhaps not choices at the individual level, but there are different vaccines available, whether it is the Pfizer vaccine, Astra Zeneca, Moderna vaccine in the United States. If you were given a choice, which one would you take? Is there a difference? We see all sorts of numbers thrown about 100% efficacy, 66% efficacy. I think it makes people feel nervous.
Yeah. So everything in this pandemic, one thing this pandemic has taught us or retaught us is really intellectual humility. Nothing is final word. Knowledge keeps evolving, and your mind needs to evolve, and your positions need to evolve. So 6 months later, the answer will be probably different to this question. As of today, I would say the 7 commonest vaccines that have published their phase 3 trials publicly, you take whichever is available. Pfizer,
Mm,
Moderna, AstraZeneca, Novavax, Sputnik vaccine, Sinovac, and Johnson & Johnson. Out of these 7, they all have been tested in over 20, 30, 40,000 individuals in phase 3 trials. Those trials have been published. And why I say take any one of them? Because all of them are close to 100% effective in preventing hospitalizations and death. And that's a better metric than looking at the efficacy. The efficacy of 67 versus 95, yes, it looks like a big difference. And essentially, it means the one with 95% efficacy, 5 out of 100 people may get COVID. The one with 67% efficacy, 33 out of 100 people may get COVID. And yes, you look at it and you say this is a big difference. But when you look at those 33 people who are going to get COVID, none of them are likely to die. None of them are likely to get hospitalized. And that is the end goal that we're trying to achieve here, right? I don't think anybody's scared of a flu like illness that puts them at home for 3 or 4 days. What we're worried
mm,
about is getting hospitalized, getting on a ventilator, or dying. And all 7 of these vaccines currently have equal efficacy. And I think it's a race against time. When you get vaccinated today, not only you help yourself, you help your loved ones, your family, your community, your country, and literally, it may sound like a cliche, you will help humanity.
mm.
So this is the purpose today. 6 months from today, I think we will know more and we will have better choices. But I don't think anyone will look back and regret that why did I get that first shot? I don't think that will happen.
Yeah. And I guess on that particular point, do you think it's likely that we're going to have to revaccinate, say 6 months or a year from now? How long do you think the vaccine is going to be effective in an individual?
That's a great question, and only time will tell. And once again, this is where intellectual honesty and humility should play. I can't make up a number. There is no number. We simply don't know. And if you came and rounded with me every day in the hospital pre COVID, you will realize that this is true for so many diseases. I'll have about 15, 20 patients any given day. And yes, I'm following the science, but I don't know the outcome. I'm just trying to give it my best effort. And then outcomes are really not in my control, nor are they guaranteed. But when you put your best foot forward, you work with science, things typically work out well. So, in this situation, we don't know the duration of immunity from a vaccine. We project that it should be more than 6 to 12 months, it should be more than a year. Will there be another booster shot needed? We don't know. If the vaccine crushes this pandemic this year to the point where there is no more virus around, I don't think a booster shot will be necessary. In some countries, it may be necessary, in some, it may not be, but there are a lot of unknowns. So I think for now, the best thing is let's do what we can, be comfortable with it, become safe today. And a year from now, trust me, whatever, if we are able to crush this pandemic and life moves back on, I'll tell you, that will be a much easier decision as compared to today because we would have seen the benefits of this vaccine by that time.
Thank you very much for that answer. I've had the COVID vaccine. I'm very comfortable saying that, Dr. Faheem. And I understand that you've had the vaccine.
Yep.
I think it's worth saying that, isn't it? It's important that that people hear that from doctors as well, that they've received the vaccination.
Absolutely.
And the
Sorry, go
point that
ahead.
I was making was about leaders within communities and about individuals who perhaps are a little bit more in the limelight and making sure that we can see that they've had the vaccination and feel happy about it.
No, 100%. I think leadership matters. As I said, in our own institution, we have over 3 to 4 thousand team members. I would take my cafeteria. I take my lunch every day in the cafeteria, and the lady in the cashier's desk is an old colleague of ours, Susan, and she's staunchly opposed to any vaccines. And every day she'll ask me, Dr. Younus, are you going to take this vaccine? And I said, Susan, I don't know. The data hasn't been published yet. And finally, one day when I had that confidence, I said, look, I will take it. I'm very comfortable now. And she said, no, I'm not going to take it. So we had a little laugh. I moved on. And then in our command center in the hospital, there was a discussion when the vaccine first came out, who will be the first one to take the vaccine? And I told them, I'm one of the incident commanders, and I'm like, I'm 100% okay. I'll be in the end of the line or the front of the line, wherever the institution wants me to. And the hospital decided that myself and one of our ICU male nurses, that we will be the first ones in my hospital. So I rolled up my sleeve and got that shot. I think this was early December. And then I came and told Susan that, look, I've gotten my shot. And she said, Dr. Younus, if you've taken it, then I think I will take it. So I have seen it up close and personal, that people want those reassurances that, yes, if you're jumping in this plane, then I'm comfortable jumping behind you because now you're putting your money where your mouth is. And I think that is very important. And that is why perhaps many of the world leaders are coming forward and publicly getting vaccinated. I think it helps.
We've talked about the fact that there is a degree of vaccine hesitancy. We call it vaccine hesitancy, but we can just say people are scared, perhaps, or worried about the potential effects of the vaccine, and that is particularly strong amongst certain communities, both here in the UK and there in the USA. When some questions come up about whether there are animal products, whether there is perhaps pork products, particular anxiety for Muslims, or whether there are animal products that may be of concern for people of Hindu faith or vegetarians or whatever it might be. What would be your response to that?
Yeah, I think it's a great question. People, by the way, all questions around vaccine or anything else, I welcome them. I think they enrich conversations. I think they make you think, they make you research. Nobody knows everything. When this question was first posed to me, honestly, Hamad, I did not know. Because I was comfortable. I never tried to memorize the ingredients of these vaccines, but it made me go back and look again. So as far as Pfizer, Moderna, Johnson and Johnson, I think, as well as Astra Zeneca, their ingredients have been posted online. They don't have any animal products. They don't have any uh, gelatin. And actually, going back to the cafeteria lady, she is a very strong conservative, and her concern was, are there any fetal cells? Her exact words were, Dr. Younus, did they use dead babies to make this vaccine? And I think that gave me a window into how people are thinking about this thing. For some, it's a visceral reaction, like you said. For a Hindu community, for someone who's vegan, they may think, were animals killed or sacrificed for this vaccine? And my request is there are about 26 vaccines out there. Each one of them have about 8 or 9 candidates, ingredients. And one of the reasons I became a physician because I was not great at math. So I cannot verbatim read all of them or memorize all of them. But at least the 3 or 4 vaccines that I just mentioned, when you look at their ingredients, there is no gelatin, pork, or animal products in them. For the rest of the vaccines, I have not looked it up, but that is all public information. And I think it's a fair question. People should ask any question that gives them comfort or that's important for them.
Thank you very much for that answer. Dr. Faheem, one thing that I know concerns you, concerns me as well in terms of the work that Humanity First does around the world, and that is the global health picture around vaccination. And we have spoken again and again, and a pandemic is something that affects all of humanity. And we know that of COVID, and we know that it's affected every single country around the world. If we are not going to be out of this pandemic until every country has vaccine available to them, then what endeavors need to be made to ensure that that is the case, that countries around the world get COVID vaccination, that it is made available to them? And will those vaccines be of the same efficacy as they are in the United Kingdom and the United States?
Yeah, so I think this is again a very important point, concerns all of us. I am sort of cautiously optimistic on this issue where I believe timing may differ, but access will be universal because of multiple reasons. One, I think the World Health Organization is working on it. And yes, they have been criticized, and leadership is not easy. It's not easy to walk in front of 8 billion people. You can make certain mistakes. I'm not defending WHO, but all I'm saying is I empathize with their position. It's not a position anyone would want to be in when you're leading an unknown virus and how the world is going to respond. So I think they're working on the program to bring these vaccines to underdeveloped countries. My worry is it will be delayed. Much of the Europe, America, Australia, North America, Canada, and some other countries are likely to get vaccinated during 2021. I believe anyone in these countries who wants a vaccine will get a vaccine during this year, perhaps before the end of the summer, because vaccine supply is going to get flooded. These markets will be flooded. If you live in other countries, if you live in Indonesia, you live in Africa, you live in Pakistan, you live in Bangladesh, or many other countries, chances are the distribution of vaccine is going to be phased. In some countries, it'll get there by 2022, and there were some projections in Lancet. Certain countries may have to wait till 2023. That bothers me. I'm sure that is not something that gives us comfort. But somehow I feel as more and more people get the vaccine, I think the world will come together. So far, I'm optimistic on that.
That's brilliant, Dr. Faheem. I'm seeing a lot of questions on the chat, and actually a repetition of many of the questions that you've already answered. So to all of those posting questions on the chat who perhaps aren't hearing the responses, go back and listen again once we've finished. But we're still going now, so I've got a few more questions for you, Dr. Faheem, if that's okay. One question which comes up again and again is, I've had COVID. Do I need to get vaccinated? So pretty straightforward question. If I've had COVID, then I should be protected.
Exactly. I think you should still get the vaccine because we don't know the duration of protection from COVID. CDC recommends you should wait about 90 days and then get your vaccine shot. There are many shades of gray. Science is hardly mathematical, it's not physics. You're working with multiple variables inside a human body. It is documented that if you had mild or asymptomatic disease, that you may not have a strong, robust immune response, meaning you may be open to a reinfection down the road sooner, perhaps. We do not know the exact duration of immunity. Is it 6 months? Is it 7 months? Is it 10 months? Coronaviruses typically give you short term immunity. Number three, we do not know if you will be protected by other variant strains. And number four, just look at the duration of this pandemic. If you got COVID in June of last year, guess what? You're already 8 months out. There are already some cases of reinfection being reported. You are very likely to get reinfected. It will also depend upon your degree of exposure and your community spread and your own mask compliance. If you work from home and your community spread is near zero, I think your risk is very low. But if you go outside, your community spread is over 5%, or if your mask compliance is not 100%, all those variables, who wants to keep track of all of that? So it
Mm.
gives you that sort of freedom. I believe once you get vaccinated, it gives you mental freedom. Like Hamad said, both of us are vaccinated. I still go to COVID units every day. I still see patients every day. I still wear my mask and PPE every day. But this also segues into another question. People say, well, what's the point of a vaccine if you're still asking me to wear a mask? That's a great question. But understand that's a transient situation, it's a bridge. We want to get to the other side where we will not need a mask. And we get there only once we have 60, 70, 80% of the people vaccinated. So if everybody starts refusing a vaccine thinking, why? Then we're never going to get to that number of 60 and 70%. So trust the science. If you've had COVID, still get your vaccine. It perhaps will give you a longer duration of immunity. It'll give you better protection. And as more people get vaccinated in the whole community, we get towards that 70% number faster.
And just on that particular point, do you feel like it's possible for us to say how long the pandemic is likely to last now that we have vaccines available to us?
Yeah, no one knows those answers, but I can give you some analysis how I approach it. I think in Europe, North America, the worst of the pandemic is over, if you ask me. It's very unlikely that we'll see something what we saw in UK, in Italy, in US, in New York, in the first and second wave. I think we have been through the narrowest, roughest part of the pandemic. More and more people are going to get vaccinated, and by next winter, I think we'll be in a better situation. Unfortunately, it's going to be different for different countries. If you ask the same question, Hamad, in New Zealand or Australia or Taiwan or South Korea or Vietnam today, they will say, which pandemic? The stadiums are already open and full. They're already living the life. So it's going to be different for different countries. If you just look at, let's change the name of the virus and say Ebola. Unfortunately, Ebola ravages West Africa every year. We know through Humanity First the kind of services we provide and what it is doing to humanity for the past 30, 40 years. And yet the world moves on. I hate to put it this way, but the reality is it is largely irrelevant for most of the people living in the world. Look at polio. Polio vaccine was approved in 1950s, and still there are one or two countries in the world still fighting the last remnants of polio. So COVID isn't going to be any different. I think this pandemic is going to shrink. It's not going to be a light switch off and on. It's going to be more like a dimmer. It's gradually going to come down at different times for different countries.
And on that particular point, we've heard a lot about different variants. Briefly, if you can just talk about that, should we be worried that the vaccines aren't going to be effective against new variants, and will we need new vaccines in the future?
Yeah, I like to use the word scariants because once again, the media has created more fear about these variants. The truth is, coronaviruses mutate all the time. This will continue to happen. Some variants, like the B117 in UK, yes, we have clear evidence it has increased transmissibility. But as far as the 1351 in South Africa or P1 in Brazil, yes, there are different variants, but so far we really don't know. Are they more lethal? Are they going to change the whole outcome of this pandemic? Are they going to survive? Are they going to fizzle away with time? What impact vaccines will have? So I'm not terribly worried about the variants right now because number one, most other than AstraZeneca in South Africa, these vaccines are effective largely against these variants. And number two, uh, I feel the current approach is working. If you look at the curve, and I know UK has worked very hard to control the second spread, but it has worked without a fancy vaccine, without a fancy treatment. Same vaccine, same treatment, but look at the UK curve. It has come down beautifully. Same actually in South Africa, and same here in US. So our current strategy is working. I think we don't know everything about the variants. A lot of this is going to unfold in the future, and we have no control over it other than our basic measures. So let's just keep doing what we're doing, and I think we shall get through this as well.
Fantastic. Thank you very much, Dr. Faheem. One last question, if I may. It's been a long year and a half of this pandemic now. What lessons do you think we can learn from this pandemic, and how can we be better prepared if something like this happens in the future? I mean, I think one lesson is that pandemics happen. I think perhaps humanity had forgotten a little bit that these things can rear their head.
Yeah, I think this is a wonderful question. I feel extremely inadequate to answer this question. I can share with you a couple of thoughts I have. Uh, I think on the optimistic side, magic happens when human beings work together. I think we've seen absolute brilliant magic from the scientific community, from the vaccine development, treatment development. On the other optimistic side, I think, you know, there's always ease after hardship. Uh, it was a difficult experience, but I think we have a story to tell our grandchildren. We have a lot to be grateful and thankful for. On the pessimistic side, I think the world is not fair, life is not fair. Those racial inequities, socio-economic inequities, I mean, we have literally seen what it has done to all of us. And another angle there is never politicize a virus, never politicize a pandemic. It does not help.
Mm.
If I were to sum up all of this, I think good communication is the lifeline of pandemic management because it's free, it's accessible to everyone. And countries that, like Vietnam, is not a terribly rich country. Uh, you wonder how did they stop this pandemic in its tracks? Good communication, deference to expertise, science and government should work together, and just think globally, don't politicize a virus. I think those are the big messages. And yes, will every country put a good preventive system in place? We know the answer. It's not going to happen everywhere. But those who will learn from this pandemic will understand that, you know, uh, an ounce of prevention is better than tons of pounds of treatment. So why don't we just invest in that infrastructure to prevent and better manage the next pandemic, which is very likely going to happen again at some point in the future.
Dr. Faheem Younus, thank you so much for your informative answers, for your look at the broad picture for COVID and vaccines, and also all of the amazing detail and reassurance that you've given, I think, to everyone watching. We couldn't possibly go through all of the questions that people have. And so I guess if people have more questions, then the information is available very widely out there. I would, I know that you wouldn't do this, but I would point people to your Twitter page as well, because you answer a lot of questions, and if people go through that, there are a lot of the answers to the questions that people have about COVID and about COVID vaccination. So thank you very much again for all of your answers.
My pleasure. Thank you so much for having me, Hamad.
And for those watching, thank you very much for joining us today. If you are watching on YouTube, then do please subscribe to the Humanity First channel. And I'd also like to request, if you want to donate to Humanity First and the work that Humanity First is doing, then you can do that by going to humanityfirst.uk.org, hfuk.org, and you can donate there. So once again, thank you very much, Dr. Faheem Younus, for joining us today on this Humanity First webinar.
Thank you. It was my honor.